Welcome to MRU E-Learning powered by Malla Reddy University. This is Sujita, Assistant Professor from Department of Cardiovascular Technology. Today we are going to talk about the topic of overview in congenital heart diseases. Before going into the topic, I wanted you to know what is meant by congenital heart defects. Congenital heart defects refers to a structural or a functional abnormality of the heart and the great vessels that are present at birth due to the defects in their cardiac development during embryogenesis. These defects can range from minor lesions like some septal defects that can resolve spontaneously to complex malformation like Tetralogy of Fallot, Transposition of great arteries and Epstein anomaly like so on, which requires a surgical corrections. Congenital heart diseases may involve abnormalities in the septae and in the valves and in the outflow tracts are in the great arteries, which affecting the blood flow patterns and oxygenization. Now let's look into the prevalence. Congenital heart diseases is the most common congenital anomaly worldwide. Global prevalence is approximately 8 to 10 per 1,000 live births. In India, prevalence is estimated between the range of 8 to 12,000 live births depending on their region and their diagnostic facilities. When we look into the incidence, estimatedly 1.3 to 1.5 million newborns are affected globally each year. In India, around 180,000 to 2 lakh infants are born with CHD annually. Advance in prenatal scanning, echocardiography and neonatal care have improved early detection and in survival rates also. However, in low and middle income countries, the late diagnosis and limited access to cardiac surgery contribute to higher morbidity and mortality. In about 80 to 90% of the cases, exact cause cannot be identified, but most cases have an unknown causes and are believed to arise from a complex interaction between your genetic predisposition and environmental influences. Still, we have some specific causes which includes abnormal embryogenic development, maternal poor nutritional status, rubella infections during pregnancy, and some contraindicated drugs which has been consumed by the mother during the pregnancy time, and heavy alcohol consumption by the mother during pregnancy. These are all some specific causes which includes congenital heart diseases. Next, we'll look into the classification of congenital heart diseases. Basically, congenital heart diseases is classified as acyanotic heart diseases and cyanotic heart diseases. Let me explain you about acyanotic heart diseases before moving into the condition what all the diseases comes under acyanotic heart diseases. First, acyanotic means it refers to a group of congenital heart defects in which there is no mixing of oxygenated and deoxygenated blood in significant amount. So the oxygen level in the systemic circulation remains normal. And in acyanotic heart diseases, there is absence of cyanosis. Cyanosis is nothing but a bluish discoloration in your skin or in the lips like that. Usually, acyanotic heart diseases have left to right shunt. That means the blood shunts from left side of the heart to the right side of the heart. Due to this, there is a volume overload in your right heart which produces pulmonary hypertension and right ventricular hypertrophy. Now let's look into what is meant by cyanosis. As I have already mentioned, cyanosis is a bluish or a purple discoloration of the skin lips and the mucous membranes caused by an increased amount of deoxygenated hemoglobin level in the blood. Always cyanosis defects happens, the shunting happens from right to left shunt. When a shunt happens from right side of the heart to the left side of the heart, there is a volume overload in the left side of the heart which produces systemic hypertension, and the deoxygenated blood passes in your systemic circulation. Usually, how can we find whether a infant or a child has cyanosis? These are all the symptoms. Like a kid will have a cyanotic spell. This is triggered mainly when a child is facing any fever, or they are causing tantrums, or when the baby is fed. This times we can expect a cyanotic spell, and as I have told, there is a bluish discoloration in the lips, skin, and in other mucous membranes as well. Now, we look into the classification. I'll explain briefly about some acyanotic and cyanotic defects. What we are looking here is a left to right shunt. Under left to right shunt, we have a ventricular septal defect, patent ductus arteriosus, and atrial septal defects. And again, there are some outflow obstructions which again comes under acyanotic heart diseases like pulmonary stenosis and aortic stenosis and coarctation of aorta. And these are all the main cyanotic diseases like Tetralogy of Fallot, tricuspid valve atresia, transposition of great arteries, Truncus arteriosus, total anomalous pulmonary venous return, and Epstein anomaly. Now, let's look into a brief note about all those cyanotic and acyanotic defects. First, let's look into an acyanotic defect, which is a left to right shunt. First defect is atrial septal defect. Atrial septal defect is nothing but there is a defect in your interatrial septum that allows shunting of blood from left atrium to right atrium. Usually, the deoxygenated blood through SVC and IVC collects in your right atrium, and then through tricuspid valve it passes through your right ventricle, then move upon to your pulmonary arteries where it gets filtered in your lungs, and then through pulmonary veins again they move back to your left atrium and reaches the left ventricle, and from left ventricle it passes through your aorta and circulates in all around the body. But whereas here there is a defect in your interatrial septum. That means there is a gap between your right atrium and your left atrium. So, due to the pressure, instead of the blood moving from RA to RV, the blood reaches from RA directly and it goes to LA. Let's look upon the types of atrial septal defect and its location as well. We have ostium primum, ostium secundum, sinus venous ASD, and coronary sinus ASD. When we look into this ostium primum, where this region, lower part of your interatrial septum, when there is a defect in your lower part of interatrial septum, is called as ostium primum. And when there is a defect at the region of fossa ovalis, that area is called as ostium secundum. Whereas when there is a defect in the upper part of the septum and in the pulmonary veins is called as sinus venous ASD. Coronary sinus ASD is the roof of the coronary sinus is not formed well, which results in communication with your left atrium. Next, we look into another defect called ventricular septal defect. It is a most common congenital heart diseases, which means there is an abnormal opening or a defect in your interventricular septum. which allows shunting of blood from your left ventricle to your right ventricle. Now let's look into the types and locations of ventricular septal defect. We have three main branches, which is called as perimembranous VSD, muscular VSD and inlet VSD. Perimembranous VSD is defect in your membranous portion of the interventricular septum is called as perimembranous VSD, whereas muscular VSD is the defect in the muscular portion of the interventricular septum. And there is one more VSD called as inlet VSD, where the defect is in the inlet portion of your interventricular septum. These are all the types and locations of VSD, which is very common in ventricular septal defect. Then, another acyanotic defect which we are going to talk about is patent ductus arteriosus. Patent ductus arteriosus is the third most common congenital heart diseases in children. Ductus arteriosus is artery connecting your aorta and the pulmonary artery, which is essential during the fetal circulation, and it closes in the first week of the child after birth. Whereas failure of this closure is called as ductus arteriosus. Continued patency of this vessel allows shunting of blood from aorta to pulmonary artery. It is most common in premature infants. Now we look into the classification of this patent ductus arteriosus, which we'll call it as Krichenko angiographic classifications of PDA. We have 6 types of classification. Type A is conical, type B is window, type C is tubular, and type D is complex, type E elongated, type S is fetal PDA. I am just giving about a brief note on what is meant by PDA and its type and location. Next we move on to next condition called as coarctation of aorta. Coarctation of aorta is a localized malformation caused by deformity in the aorta, which involves coarctation means narrowing of your coarctation means narrowing at your descending aorta at the site of ligamentum arteriosum immediately distal to your left subclavian artery. Also, coarctation of aorta has 3 types, which is ductal, preductal and postductal. When the narrowing happens prior to the ductus, that is called as preductal, and when the narrowing happens at the ductal region is called as ductal, and when the narrowing happens post ductus is called as postductal coarctation of aorta. So far we have seen few acyanotic heart diseases. Now let's move on to cyanotic heart diseases. First, under cyanotic heart diseases, we have a case called Tetralogy of Fallot. TOF means it refers to a combination of 4 different heart defects which commonly occurs together. We'll see what are all the 4 common heart defects. One is pulmonary stenosis. Second one is right ventricular hypertension, and third is overriding of aorta. Fourth is ventricular septal defect. All these 4 heart diseases combined together is called as Tetralogy of Fallot. Next, we look into a cyanotic diseases called as transposition of great arteries, where switching of either ventricles or great arteries. We all know about the anatomy of heart. Let me remind you once. Always, right atrium is connected to your right ventricle and left atrium is connected to your left ventricle. As when there is a switching of arteries, first let's look into the normal connection. RV is always connected to pulmonary artery and LV is connected to aorta. Whereas in this case called DTGA, these arteries switches. Aorta arises from your RV and your pulmonary artery arises from your LV. And there is a ventriculo-arterial discordance of aorta to RV and pulmonary artery to LV. And there is one more type called as LTGA, where the ventricles switch. Instead of right atrium and right ventricle, right atrium and left ventricle, left atrium and right ventricle. This is how the chamber forms. This is called as LTGA. In this, where the RV and LV get switched, but the arteries remains in its original position. This is called as transposition of great arteries. Next, we'll look into truncus arteriosus. Single great artery with a semilunar valve that arises from the base of the heart and gives rise to the coronary and pulmonary and systemic circulation. We all know we have two great arteries. One is aorta and another one is pulmonary. Whereas in this case, in truncus arteriosus, we'll be having a single great artery with a single semilunar valve, which is always associated with a ventricular septal defect. Next, we'll look into a total anomalous pulmonary venous connection or pulmonary venous return. The anomaly in which pulmonary vein have no connection with your left atrium. When we look into a normal human anatomy of heart, all the four pulmonary veins get drained in your left atrium. Whereas in this condition, all the four pulmonary veins doesn't have any connection with your left atrium, which confluences and drains into your right atrium. PFO or ASD is associated to maintain a systemic circulation in this condition. That is why the patient has a cyanotic effect. Next, we'll look into Epstein anomaly. Epstein anomaly is one of the rare condition in congenital heart diseases where there is an apical displacement of your tricuspid valve attachment. Difference between your mitral and your tricuspid annulus exceeds 10 mm. Due to this displacement of the portion, an anatomic RV physiologically serves as a part of RA, which we'll call it as atrialized RV, which appears like your right atrial enlargement, but it is because of the displacement of your tricuspid valve. It mostly occurs with an associated anomaly called as atrial septal defect to neutralize the systemic circulation. I would conclude this topic with a take-home message as congenital heart diseases is a significant global health concern, being a leading cause of infant mortality from congenital anomalies. Early detection, timely surgical intervention and improved neonatal care are essential to improve the outcomes in the mortality rate. Thank you.